Hello, 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 everyone. This is such a beautiful day. I welcome you to Just One Touch. I am your host, Minister Coretta Wren, or Coretta, however you wish to acknowledge me. We are here today. It's a special edition for Just One Touch. It is our Health Awareness Month, and I have special guests from various medical arenas as our guest this month. And I'm so excited because I have someone that is very dear to me here. And her name is Cashoyna Tillis. And I would love to welcome her. How are you doing? How are you
I am
doing
doing
today?
well. I am doing well. Thank you so much for the invitation to speak with you today.
So happy to see you here, my close relative.
Yes.
And you're so close to me that you saw me when I was a toddler. You saw me when I was a toddler. But I am so honored to have you here with me. I haven't spoken with you in such a long time. So my heart is so heavy to just see you. I see that you have accomplished so much in the time that we have not seen each other. But I would like for you to tell me and tell our viewers, how would you describe yourself to those who have never met you or who do not know who you are?
My name is Cashoyna Tillis. I was born and raised in Liberty, Mississippi. I'm a true country girl. And I'm also a mother of two daughters who I love very much. They're teenagers, so please pray for me. I have a 13-year-old and a 17-year-old. So I'm on that side of life now. In addition, as a professional, I am a nurse practitioner specializing in pediatrics. I love what I do. I love taking care of families. I love taking care of children and just being a part of the support system for the families in my community.
Nurse practitioner, Tillis. What is a nurse practitioner? And in your own words, can you give me a definition for those that do not understand or know what that type of profession entails?
Okay, so many people are familiar with a physician, and that's very common knowledge. Physician assistants and nurse practitioners. I'm a nurse practitioner, which means that in my profession, I started out as a registered nurse and I went back for an advanced degree to be able to provide care, um, prescribe medication, and create treatment plans to take care of patients. So I can do many of the same things that a physician can do. I don't do any surgeries, although I do procedures. If you have an abscess or anything like that, I can lance it. So, as a nurse practitioner, I do many of the same things that other primary care providers do.
Are there many African American women in this field? I know when you started, were there, or has it grown?
I would say that it has grown. Statistically, only about 5.5% male or female African Americans serve in the provider space, either as physician assistants, nurse practitioners, or physicians. So it is a space where 5.5% of us are, but there's not a large amount of us at this time. So in that 5.5%, that's male and female. So if you break that down, then even a lesser percentage are female and African American in this space. I would say that getting into this arena, I am more individuals and women of color coming into this space. When I started out, I knew one nurse practitioner prior to me becoming a nurse practitioner. And I met her at the University of Texas at Houston, and she was managing their occupational health clinic. And I was like, wow, this is amazing to see you doing what you do. I did not know that you could do this. as a nurse, that this is an additional step that I can take in my education to become a nurse practitioner. Say this was about 1998, 1999. I graduated in 2001 from Prairie View A&M University. And once I started working in the emergency room, I also met a male nurse practitioner, African American, who was in the emergency medicine space. That was also inspiring for me. Not only was he in the emergency room taking care of patients, he was also a professor, faculty at Houston Baptist University. I was intrigued by that. I have a mentor. I've known her, Dr. Latricia Harrison in Houston, Texas. I've known her for many years, and she was that individual that I could see every day. We're fellow church members. We both graduated from Prairie View A&M University, and she would tell me, "You need to go back to school and become a nurse practitioner." And I'm like, I don't know about that. She stayed on me. She stayed on me for years until finally I was like, you know what, I'm going to consider this. And I also have to give a shout out to Dr. Crystalline McDaniels, who was the final kick in my behind to go back to school and become a nurse practitioner. Not only did she walk into the job where I was and say, "Girl, what you still doing here? You ain't going back to school yet?" But she allowed me to shadow with her as I was really considering that career path. So there are individuals in my life and in my circle who have pushed me forward, encouraged me, mentored me. But I will say, back to your original question, there is not a lot of representation of Black and Browns in the nurse practitioner
How many
field.
years have you been in this field?
Girl, you about to make me age myself.
Well, I'm older than you, so it doesn't matter.
So I have been I have been in medicine for 25 years at this point. Even when I say that, I'm like, oh my goodness, what? Have I been in medicine that long? But I've been in medicine for 25 years, and I have been a nurse practitioner for a decade this year.
Oh, wonderful, wonderful. As you have grown, what lessons have you received that will help you continue to reach and grow on your journey?
One of the things that is really big to me is mentorship. Being mentored and also being a mentor. I mentor many students along the way in this path. It's my way of giving back to it's my way of giving back to the community, and I really love to do that. One of the biggest lessons that I learned is to always have a mentor and to have an advocate. When I started as a registered nurse in the emergency room where I worked, there were only 3 African American women. And as I was being mentored by a male and someone who was not African American. The African American woman continued to watch and monitor my progress unknown to me. And when she felt that that's a fit for her, and I was not speaking up for myself, or did not know that I could advocate for myself because I was a novice in the field, she advocated for me. She stepped up and she said, "Hey, I want to take her under my wings. Can I begin the process of mentoring her? I want to remove her from the situation that she's in under that mentor, and I want to mentor and educate her myself." So a big aspect of moving forward is having advocates and having mentors. Mentorship is extremely important. Also, it's very important to continue to be a learner. I am a lifetime learner, continuously educating myself, staying on top of the latest research and treatment options. So it's very important that you continue to do that and have that mindset if you're going to go into this field. Medicine is changing all the time. Every 5 years, there's a big change in treatment plans. Even how we treated asthma years ago is not how we treat asthma now.
Okay. Get into some health questions. And one of the questions I want to ask you is, what are some regimens that one may use that could help with stress? A lot of stress issues among our our not only our culture but within our society, be it work,
Mhm.
family, whatever that issue that causes stress. What are some regimens that one could use to help release that
We
stress?
have both free regimens, ones that you can do on your own, and then we have some assisted regimens. So for the free regimens, I would recommend exercise. Exercise is like one of the biggest things to relieve stress. And that could be as simple as a walk outside in nature. God has created nature in such a way that it is a blessing to us. Being out and walking and your feet the ground, being able to look around at the atmosphere, whether it's snow or whether it's rain, and just being able to behold the creation. There's a power in that. We don't necessarily know how to explain it. The power in that movement. So one is I'll recommend go exercise and get outside when you can. Don't just get in the car to go from home to work. Take a quick 5-minute walk, but exercise at least 30 minutes a day. It's recommended to get 150 minutes of exercise a week and break that up. We don't want you to try to do it all in one sitting. Break that up. Assisted things that you can do is you want to make sure that you're talking to someone. Who can you talk to? Is there a trusted friend that you can talk to and tell about what's going on in your life, what the stresses are in your life right now? A pastor, a mentor. Additionally, you can also speak to a therapist. These are great ways to manage stress. Breathing, learning breathing techniques are very important. And also learning how to let go. Sometimes letting go can be using a journal to write out your thoughts, talk therapy with a friend, someone trusted, or a therapist. These are in our community, the African American community, we are stepping into spaces where we actually feel like these things are beneficial, where we are becoming aware that stress can cause induced symptoms and that stress can kill and it can create problems within our bodies. So we have to find ways to manage that stress. Those are some of the big ones, including your make sure you're getting your water in and make sure that you are eating well. The more high fat, carbs, saturated fats that you're eating, it drains your body in a sense, meaning it makes you feel less energetic. So we want to eat healthy foods, lots of fruit, lots of vegetables, get that meat in, and make sure that you're cutting down on sugars and carbs. That's very helpful as well related to stress.
Now, I had an incident uh, about a year, 2 years ago, and I was honestly not realizing that it would occur. I had a vertigo about 2 years ago. I was at work, and that morning, my mom, she said, your lip was is looking funny," and I did not realize it. And I was at work, and my boss, because I was a teacher, and my boss, one of my coworkers, saw me walking funny, and
Mm.
she went and told my boss, and my boss came to my room. My principal came to my room, and she said, "You look like you are having something wrong with your. You got to go home." She was telling you. I said, "No, I'm gonna go home after work." And she made me
Mm.
go home. Another assistant principal came in, and she said, "You're having, you need to sit down." She wouldn't let nobody come in my classroom or anything. And once they called the emergency, the ambulance to come and get me, the lady said, "You were possibly having a stroke." To find out, when I got to the hospital, they told me I was having Bell palsy. I
Mm.
did not know what that was. I had never heard of it. I never really heard about it. I may have heard it, but I never really paid attention to what it was. And that scared me to a
Mhm.
point. But to help me understand what is some of, because I was kind of, and I did not realize it, but a lot of things were bothering me, and that encountered the, I believe it was stress. But is that something that occurs, that can happen to you by a stress, by being stressful, the vertical
Um,
and the Bell palsy?
okay. I'm going to ask one more question before I answer. Were you ever diagnosed with a stroke or just the Bell's palsy?
Just the Bell palsy.
Okay. All right. So vertigo can be brought on by stress. It can. Bell's palsy itself is usually not brought on by stress. However, a cousin of Bell's palsy, I would say, is a stroke or a CVA incident, and that can be brought on by stress. Bell's palsy is usually caused by a virus, an infection. Lyme disease can also create that. In adolescents, sometimes if they have an increased BMI, that can also lead to Bell's palsy as well. And very interesting in your story is how many of us treat symptoms in our body. You said, no, I'm going to just wait till the end of the day. When people were actively like, girl, something wrong, something is not right. But, and so in addition to stress and managing our stress, we have to be mindful of our body and our body's symptoms. And if there is something that's off and abnormal, we need to go seek medical attention. Medical attention is very important because, as they say,
Right.
an ounce of prevention to prevent something or to get it in the beginning stages is more important than cure.
Well, what happened was, before it occurred, I was going to the eye doctor because my eyes were uh, very irritated, and I kept thinking I needed glasses. You know how you sometimes go and get vision. I went to a regular
Mhm.
vision doctor, and he sent me to a special eye specialist because I had literally lost my sight. I went blind in both my eyes, and to a point where I could not tell the colors that were in front of me, and everything looked white. All I could see in my I was sitting in my living room, and all I could see was the brown color on my cabinet. That's the only thing I could see in my room, in my house, as far as in the living room. And it was
Mhm.
concerning me, and it scared me. And when I went the uh, to the doctor, she identified something on the side of my left eye, inside. I think it was like a little uh, lump node or something. And they put me. She told me when I went. She told me she wanted me to go in the hospital that same day.
Did you
And
go?
I didn't go because my mom was kind of concerned. She didn't think it was important. It wasn't that it wasn't important. You know how you just think it was something that could be resolved later. But uh, the end of the year of my school year of 23, I did not even complete my last day. That was the day that the incident occurred for me at the school. And when I went to the doctor, I then went back in the end of June. This was March when I went to the doctor previously, and she told me I had to go into the hospital, and I didn't
Okay.
go. But immediately that day that I went in the hospital, she put me in,
Okay.
and I stayed in there for 8 days. And from there, uh, they have identified it as psychodosis, nerve psychodosis, through all that. So it is important. It is important that you uh, listen to your body. It's important.
Yes.
It's very important. And I believe if uh, I hadn't told my mom, I was just trying to go through it because it was a lot going, and I was scared, but I did not communicate those illnesses that I needed to until
Yes.
it got to the point of where I needed to go into the hospital.
Yes.
So
Yes.
I do encourage people to communicate. I honestly believe, is it not important for family to even just sit down and communicate with each other, even when they are feeling good or if they're feeling bad? Either way, should they have that communication line about their health?
There definitely should be communication about how you're feeling in your household. And it should be open communication, whether it's a headache or I have daughters who there may be cramping, or you may have sons in your home who, may have an injury from sports, or they may just be sore from sports. The more you communicate in your family, in your household, with your friends, it helps them to help you identify when something is abnormal. Just
Right.
say, for instance, you tell them, "Oh, my eye is bothering me." And 2 days later, you say, "Oh, it's better now." If
Right.
you are continuously communicating to a friend, if you have that eye issue again, they're going to know, "Oh, this usually lasts her about 2, 3 days and then she's good." But if it lasts a week, they're going to say, well, that's not normal for you. How long does that normally last? I don't remember it lasting this long. And things that I talk to my boys who are in sports about is I talk to them about concussions, and I talk to them about how important it is to be absolutely honest about what they are feeling. And the reason is because boys want to play, especially my football players. They want to get back on the field as soon as possible. And I have to tell them, listen, if you have a concussion, it is your responsibility to be honest with your parents and to be honest with your coach so that you can come out of the game and be out 2 or 3 weeks versus re-injuring yourself and maybe being out 6 months, because that is potentially a risk if you re-injure yourself. So I encourage them, you need to have communication. The questions that are being asked of you: does your head hurt? Memory loss? You feeling more fatigued mentally when you're at school? It's very important that you answer these questions 100% honestly, because nobody knows what you are feeling but you. So the only way to share that out is to communicate it. So communication with our family, with our friends, with our doctors, the primary care providers, it's extremely important. And don't hide anything. Just say it all. Even if you
Yeah.
feel like it may or may not have a consequence on what you're dealing with at that time, still say it. A lot of
Right.
times it does.
Tell me this: what percentage of our community has the most issues with stress? Parents look for when their children are in that stress mode.
Okay. So there are three communities that I will tell you about that have very high stress levels. First is the African American community. Second is the Hispanic community. And third is the LGBTQIA community. These are the communities that have the highest amounts of stress. I would say, if you're a parent trying to see what is going on, what has changed in my child, or being able to identify that a child is having more stress, if their mood is changing, this child is usually very jovial and now they're crying a lot, they're more withdrawn, they're sad. Watch their speech. How are they speaking about themselves? Are we having failure talk or negative self talk or poor self image? Um, Big changes in personality, changes in their friendships. Those are things as well that can be an indication there's a concern. Withdrawal. Um, one of the big symptoms that everyone will react to, but we want to react before we get here, is suicidal thoughts, suicidal ideation. We jump at that time like, oh my gosh. But oftentimes something has happened before. If there has been any trauma, any big changes in the household, a loss of a loved one, a divorce, a loss of a friend that they have, not just in the house, but even outside, a loss of a close relative, a change in their grades, a change in a dream, or any type of trauma that they have experienced, abuse or otherwise, you need to watch them to see how they're responding. I recommend that any child who has gone through trauma, where there's a life transition, I do recommend that they get counseling, that they get help. And I also recommend that parents would, with their children, decide on 3 adults that they both agree on, that that child can talk to at any time about anything. As parents, we want to figure it all out for them. But community is very important, because if I'm getting on nerves, she probably not going to tell me, but she will call my sister and say, Mama is getting on my nerves. And I want her to have that outlet so that 100% of the time, I know that my daughter is covered on some end related to her stress levels and how she's feeling. Even if I'm not the individual she wants to talk to about that, she has resources that also help me to help my child.
I am constantly into physical therapy because of my vertigo. My question: can this occur in infants? Vertigo that and Bell palsy that I had, does it occur in can it occur in youth also? Does it just occur in the older stage of life?
Yes, actually, the highest incidence of where Bell's palsy starts is in adolescence. So when children are teenagers, we see that. It can be the reactivation of a virus that causes that nerve to become swollen or irritated, that causes symptoms. Vertigo as well can occur in children and adolescents as well. Sometimes when we think about Bell's palsy, we think about stroke. The interesting thing about a stroke is that a stroke can occur before labor and at any point in life.
Oh,
So that's
really?
while the baby in utero
So it can
up
occur
through
in
adulthood.
it can occur even during the time that the mother is in labor. I mean, not labor, but pregnant during that time. That
Yeah,
those
a
times.
stroke.
That's what I'm asking. Can it occur as before the birth with during the time?
Yes,
Oh, okay.
yes, a stroke can occur before birth.
One that's pregnant. What identifications of symptoms do they need to be watchful of if that does occur?
So usually, if there are concerns for stroke, that mom will be seeing a neonatologist, and they will be doing continuous monitoring of the child. One of the things in utero that moms pay very special attention to is the child's movement, how the child is moving. And are they moving as often as they were moving the week before, the month before? Because as you become further along in pregnancy, they start moving and kicking more until the belly gets so big they can hardly move, but they're still kicking. They're still getting some movements in there. I would say be paying attention to the movement of the child. And you also want to do your visits with the neonatologist. Um, Taking it a step further, say for instance, there's a child who was born and there are no symptoms, and what to look for as far as a stroke is concerned. You want to look at if that child is, they were feeding just fine and now they're not feeding as well. They don't want to eat as much. They don't want to, they're not as active as they usually were. And you can even sometimes see changes in like facial structure or weakness on one side. They're raising one arm, moving it around more than the other, where the other one is a little more weak or floppy. So those symptoms can occur. The biggest things with newborns or infants is watching those feeding patterns and watching for any changes in the neurological system like seizures, um, and movement, as I stated before. like one side is weaker than the. But we also understand it as children grow up, the symptoms are very similar between adults and children, with the one-sided weakness, and there can be some drooping of the eyelids, the smile, and the facial structure as well.
Awesome to receive this information because health uh, is very important to keep yourself aware of your body, your mind. You
Mhm.
need to keep those things in working. Can you please let us know what your area of profession is? What do you specialize in?
I specialize in pediatrics.
Pediatrics, and I know you have now. Pediatrics, normally you think about just the children, but you are a family pediatrician nurse practitioner, correct?
Yes, I am a family nurse practitioner, and I have experience with the full age range in my care of patients. So I've practiced in family practice, but primarily in pediatrics. That is the area that I love and that I feel called to. And so in the pediatric realm, I take care of 0 to 21-year olds. That's newborn, fresh out of the womb, up to 21 years of age. But when I practice in the family practice area, then I cover the rest of the age range.
My last question for you. I have really, really, really have enjoyed uh, this conversation. I wish we could go deeper.
I have as well.
I wish we could go deeper. I may invite you again to talk
Feel
about some
free.
other areas of health, but I do appreciate you. But before we leave, I have one more question for you. You have been acknowledged uh, for many things as far as your service within this field. Uh, as a woman, and as a African American woman, as far as an inspirational point of encouragement to those who seek or may seek the opportunity of pursuing a career in this area, within any area.
I would say whatever your heart desires and whatever your goals are, focus on your goal. Don't worry about the things around it. And if you know what your goal is, you need to start creating opportunities to expose yourself to that. Say for instance, you want to be an astronaut, then you want to expose yourself to that. See if NASA has any events that are going on in the summer. If find an astronaut and reach out to them, you want to expose yourself to that so that you are aware of what it is and what it takes. But you need to focus on the goal. Research, exposure, and mentorship are very important. I also am one of the writers in this book. It is called The 9% Black Women Leaders Tell It Like It Is. And there are about 10 of us as African American women sharing what it's like in the workplace when you are in workspaces where you're not represented very highly. Many of the spaces that I have been in, um, the African American percentage in that space is 10% or less. So this is a very good book, which you can also get on my website, which is Cashoyna.com, CASHOYNASPEAKS.com. And it has lots of tips. Because one of the things that I also feel is very important on your journey is community. You need to have community with you and around you. And how we build community is we have to talk to people. We have to get the information. We have to be exposed. And we need to see representation of ourselves. If you don't find representation of yourself in the field, there are also other mentors and advocates out there who would love to see you be successful. So, again, focus on your goal. Don't focus on the barriers.
Can you give us that uh, website address again, as far as
It
where
is,
one can obtain your manuscript?
yes, it is kashanyaspeaks.com.
Nurse practitioner Tellers, I do appreciate you coming on. Just One Touch has been a privilege, an honor to speak with you and to retain the knowledge of health awareness information that you have provided. I pray that all who hear this and see this broadcast will obtain the information and be very helpful for them in whatever area of concern they may have. Thank you, thank you, thank you.
Many people say home is where the heart moves. But my grandmother taught me that home is what you make it.
I'm just trying to figure out why they won't let me meet my parents. I mean, I am just so tired of being treated like a baby. Man, I can't wait until I graduate.
The time has come.
Time for what, baby?
Nellie's been asking about her mother.
No, she's not ready for that. I don't want that baby hurt.
Have you heard from my mom?
Liz! Oh, my Lord. And our family, we are small but mighty.
Now, do you think you can speak to Mr. Kearney for me? And does Nellie even know that I'm trying to see her?
I have to choose my time wisely to talk about you, son. But keep the faith.
Well, thank you for your help anyway, Miss Liz.
Oh, I haven't done anything yet. I don't want to lose a good friend.
You cannot stop me from seeing Nellie.
Well, I got 9 hot ones and a whole lot of land that says that I can. He ought to be scared.
And you ought to be shamed.
I mean, I'm not trying to hear this in my home. How you hush up with this foolishness?
Hello?
Hello, Everett?
Suffering is a part of life. But God gives us scripture to get through.
You will never get to my Nellie.